Well, let's get some more analysis on the COVID-19 situation across Europe and where this all leaves the vaccine rollout. Well, let's get more from Oksana Pyzik, who is a global health advisor and lecturer at UCL in London. Thank you so much for joining us. I mean, what makes this news all the more depressing is that the slow vaccine rollout here in Europe is facing another setback and now halting the AstraZeneca vaccine. I mean, was that the right thing to do you think?
I think that given the light around the evidence that there is not any more blood clotting than what we would generally see in the population, that this was probably not the right move at this time, and people are still dying of coronavirus within Europe. And as we see globally, there has been an 11% increase, with a big concentration of that being in Europe itself. If we think about the risk associated with blood clotting, we see that it's even higher for medicines that are such as the combined hormonal contraceptive pill, the oral contraceptive pill. For women, that's a risk between 3 to 9 in 10,000 people, which is, again, when we see the COVID vaccine, 2.6 million people so far have died of coronavirus across the world, and 0 have been directly linked to any of the vaccines. And 11 million people have been now vaccinated in the UK due to a very successful vaccine rollout strategy. And again, there's no trend indicating a higher than average amount of blood clotting. Again, if anything, coronavirus itself, the SARS-CoV-2 virus, is known to, if you're exposed to that, to cause cardiovascular complications, blood clotting, etc. So given the measures taken, the precaution around it seems excessive. And my other concern is the flip-flopping. First, we heard that based again on no solid evidence that it wouldn't be effective in age group over 65. That has since proven to be incorrect. And it already caused a hesitancy within Europe. We heard from Emmanuel Macron making that specific claim. And now there are doctors, nurses signing petitions, threatening strikes to get the mRNA vaccine over the Pfizer, over the AstraZeneca vaccine. And I think that now with this further announcement, I think it'll be very confusing for the public. They're unlikely to dive into the pharmacovigilance data. It's going to be the narrative around it. And I don't see this being beneficial towards a European effort that is already so far behind in vaccinations.
Yeah, as you say, it's going to be very difficult to persuade people to go and get the AstraZeneca vaccine now after all of these rather negative headlines. Just bring us up to speed, since you're in the UK. I mean, the UK is a very interesting case study, isn't it? Because a large chunk of the population has received at least one of the two COVID-19 vaccines. I mean, what is the situation like now? And shouldn't that be sort of the roadmap, especially perhaps with AstraZeneca in the back of everybody's mind as well, of how a rollout can actually hasten the process of people getting back to something resembling a normal life?
Yes, well, in the UK, we still have quite extensive restrictions, despite the fact that we are now exceeding vaccination targets. Partly because we don't have to remember at the very beginning, too long ago, at the beginning of the pandemic, we saw that the UK had the highest mortality rates per capita in the world. So this has been a big turnaround in terms of a success for the government. And I do think there's some really important lessons to be drawn from the UK. Partly, we did have a head start due to the fact that the MHRA was the first out of the gate with the authorization. But then following that, even before this, when we look at the Joint Vaccination Task Force procurement strategy, they really prioritized being able to have manufacturing sites in the UK, specific clauses within contracts that enabled them, despite a higher price that they paid compared to the EU, it meant that they could get the vaccine supplies faster. And when we compare this to the EU, the supply element has been one of the greatest challenges, but clearly not just that, because in France, we see that the GPs are, struggling to be able to get jabs in arms, and that there's a stock on shelves to the extent that they're not even getting their next orders, and pharmacists are going to be contributing at a greater level. But that early procurement strategy that the UK was leading on really ended up being the winning one. And it wasn't just that. We also in the UK have a high acceptability of vaccines. There is more effort to tackle misinformation, quite expansive vaccine network as well, which has been fundamental in the speed of the rollout. And of course, at that time, it was very controversial, but the UK was the anomaly in the world. They prioritized the first dose instead of giving it identical to the clinical trials. They extended that gap to 12 weeks. Again, there was a lot of resistance to it, but the evidence shows it was the right call. So I do think that this could be replicated in other countries. But with the vaccine hesitancy issues, the news around AstraZeneca vaccine, I think Europe is going to be in further trouble because it appears the vaccine efforts are not immune to politics.
Okay, well, thank you very much indeed for sharing that with us. Oksana Pyzik, a global health advisor and lecturer at University College London. Thank you.